Dallas On Air. 17 years of real talk, real stories, and real Dallas. From the heart of Texas to the ears of the world. This is Dallas On Air.
You tune it in to Funky Disposition, where menopause meets the mood swings. Real talk and good vibes. Hope, hot flashes, cold truths, it's a funky ride. Let's talk menopause and take it all in stride.
Hello, welcome to Funky's Disposition, Menopause Moods. And today we are talking about HRT, hormone replacement therapy. And as always, I want to thank God for giving me this idea to be able to come out and share different things with you all so we can educate you, so you'll be able to know our experiences that let you know that you're not alone. Today, I want to introduce my guest speaker today. Her name is Inyota Stoker, and she will be talking about HRT. So here's Inyota Stoker.
Hello, hello.
Hello, how are you?
I'm doing well, thank you.
Awesome. So just give us a slight introduction and take it away.
So, as Trina said, my name is Inyota Stoker, and just shout out to my beautiful sister-in-law,
Yay.
Trina. Yes, we are related. So, want to say thank you for having me here. First thing, disclaimer, I just want to put out, I work in the healthcare profession, and I am a healthcare professional, but I am not a healthcare provider. So I can only speak from my own personal experiences,
Yes.
and then just some of the professional work that I do, but I am not a provider, and everything should be done by speaking individually with your healthcare provider.
Correct.
So tonight, though, I am speaking from my own personal experiences.
Yes, and as you said, we are not healthcare providers. Consult with your own healthcare provider, your PCP or whoever, menopause therapist or whatnot, and they will get you on the right track. So tell us a little bit about yourself.
So my journey with hormone replacement therapy began a year ago now. What I decided, I started noticing, I am 48 years old, and I started noticing just different changes, just the mental fog, and looking at pictures of myself and bloated face and just different things. And it's like, wait a minute, what's going on? And I had a coworker, and she said, oh, you need to go talk to somebody. Well, I think one of the things is we as women always think that that's just normal. Oh, I'm tired, extremely tired. Oh, I'm this. Oh, I'm that. I've got too much going on. I'm just too busy and things like that. But there are really actual hormonal changes that are occurring that are not just being tired because you're working or you're taking care of your family or you're in the sandwich generation taking care of aging parents, children, grandchildren. It's a whole multitude of things, and it's not just the everyday outside factors of life. It's also your system and what's going on with your body. And so for myself, I went to see a hormone specialist. She is a nurse practitioner. She is also delivers babies. She's a gynecology nurse practitioner, so she does the whole gamut. But she is also, she laughs and says, I'm running a menopause clinic here out of the our practice, our OB-GYN practice.
Oh,
so
wow.
She is not specifically, and she does have her training in menopause therapy.
Oh, wow. Okay.
Yep.
Right on.
Yep. So one of the things, and actually this is, I heard a couple of our providers talking the other day. One of the things I want to change with that whole myth of what the term hormone replacement therapy, they're actually saying we shouldn't even call it that. We should be calling it HRT, hormone replenishment therapy, because that's really what it is. We're not replacing,
Yes.
we are replenishing the hormones that our body has now lost or is starting to lose.
Yes. Yes. You can't like really replace it. So yeah. Okay.
Exactly.
Yeah,
Exactly.
that's pretty cool. They should call it that. Right
So
on.
hormone replenishment therapy, we're gonna start a movement to change it to that.
I like that. I like that a lot. So let's
Mhm.
get started. So
Okay.
can you explain what hormone replacement therapy (HRT) is and how it works, or hormone
So the way
replenishing
hormone,
therapy?
yeah. So hormone replenishment therapy, it exactly is what it says. It is a process using estrogen, progesterone, testosterone, any one of those, any combination of those, to replace the hormones that are naturally depleted through perimenopause and the menopausal process. One of the things to note is that, and this is the way it was presented to me from my menopause specialist, is that she said we have to look at it as though, just like with your thyroid is a hormone. And if you have thyroid issues, you take medication for your thyroid. So why is it any different when we're replenishing estrogen, progesterone, or testosterone?
Oh wow. Okay.
Because it is a hormone.
It is a
Your
hormone.
thyroid.
Yes.
Yeah.
Yes, it
So we
is.
have to stop. I think that's the thing. It has so much stigma behind it, and we have to get that out of our head that, hormone replenishment or hormone replacement therapy is a bad thing, because it is not. Our
Right.
bodies naturally, we were born with those hormones, and they just started to deteriorate.
Wow. I don't think comparing it to the thyroid, I don't think people really thought about that a thyroid is a hormone.
It
But
is, right. And I didn't think about it either until she presented it to me that way. And I think that's the way we just have to start changing our frame of mind and how we think about things.
yes, really start educating ourselves. Wow.
Exactly.
Cool.
Exactly.
That's cool. So what are the most common symptoms HRT is used to treat during menopause?
So of course the big ones, and you've talked about them throughout your other
Yes.
sessions: the hot flashes,
Yes.
the night sweats,
Yes.
the mood swings,
Yes.
vaginal dryness. That's
Yes.
one I don't think we've talked about yet. We'll
Not
cover
yet.
that. But we'll cover that this evening. Decreases osteoporosis.
Oh wow.
Yeah,
Yes.
yeah.
Wow.
So there's a whole decreases cardiovascular risk.
Oh
Those are
wow.
the things that we don't know that hormone replacement therapy does. It actually has beneficial effects when you replenish the estrogen and progesterone in your body.
Wow. Yeah, because with your hormones being unbalanced, it really can do something to your cardiovascular system, and people
Yeah,
don't know that. But yeah, you are more susceptible to have different heart issues.
correct,
Yeah.
correct. And so I'll just back up and just tell you how I ended up getting started. So when I said I started hormones about a year ago, it's been a year ago. What I did was I came off of birth control pills and had an IUD inserted. And I had never had an IUD or anything like that. I was over time like, oh my gosh, like why would I want to do something like that? There were just things back in the day where they were like, oh no, you don't want to get things inserted in your body long term and things like that. But once you get to a certain age, the IUD is not only the birth control, but it protects the uterus lining from overgrowth. And that's what happens while you're on the estrogen. So when you have the estrogen, your body is taking the estrogen, it can cause an overgrowth, which can be harmful to the body.
Yes.
Okay.
Yes.
That is a risk factor of having the estrogen, which is the overgrowth of the uterine lining, which can lead to uterine cancer and things like that. However, I'm on an IUD, which decreases that lining overgrowth.
Okay.
So there's so many combinations. That's why I said there's not one size fits all therapy for all women.
Right.
This is really something that has to be tailored for you by your healthcare provider and your healthcare expert.
Okay. Because I thought women that had hysterectomies, they're okay to be on just the estrogen. But if you have your uterus, then you need to be on estrogen and the progesterone.
Correct. So
Yes.
I don't take any progesterone.
Okay.
Okay, so I just have the estrogen patch. I have the estrogen patch. I place it on twice a week. It's really small. It actually looks like a Band-Aid.
Okay.
And you just place it on the abdomen. I switch every side from the abdomen to the back of the upper buttocks. So over the course of the month, I've hit all 4 quadrants of around the midsection.
Oh,
And
wow.
so I just take that patch, I put it on, and the benefits of that patch is decreases the cardiovascular risk, decreases your metabolic syndrome risk, reduces and protects bone health. It is so important for the bone health.
Oh,
But
wow.
again, I still have my uterus, so I don't take the progesterone.
Okay. Okay.
Okay.
Yeah, so the metabolic, yeah, what'd you say, the
The,
I can't get
the
out.
metabolic syndrome risk.
Oh, yeah,
So
so that keeps you from the gaining the weight and your
exact. So
weight
the
going
metabolic
crazy.
syndrome risk is
Yes.
where you get that hole, where women tend to get that whole middle,
Yes.
and you turn
Yes.
into just an overgrown, abdominal,
Spare
overweight,
tire.
obesity, or the apple. That definitely helps with that.
Oh,
I will say
wow.
personally, after being on the hormone patch for 6 weeks, I noted a slight elevation in my mood. It just everything didn't feel so heavy,
Okay.
at that time. So it was just a slight, like little more euphoric, a little more like,
Yeah.
sigh of relief. I did notice that I don't want anyone to think you're going to lose weight or anything. I lost inches. In my abdominal or my midsection. Not significant, but enough to make a difference where I didn't feel so bloated or so overweight or just didn't feel good.
Yeah.
Now, I will say I've never experienced night sweats. So my hope is that having started the hormone patches, the estrogen patches, that I can avoid getting the hot flashes.
Oh, wow. Okay.
So I
That'll
don't
be
have the hot
good.
flashes or the night sweats.
Oh, that's
And again,
good.
as your other guests have said, that's not going to be everybody.
Correct.
Um,
Correct.
But I don't know. I just hoping that I can avoid it being on my estrogen. And
Good
with
luck.
the IUD, yeah, no, good luck. To see with and we'll evaluate all of this in the next 5 years.
Yeah.
Me and my healthcare provider, as the IUD is only for 5 to 7 year placement.
Okay.
So then at that time, I may need estrogen.
Okay.
I may no longer need the IUD. So we'll just have to take and reevaluate at that time. This is something that's just not a one-stop shop.
Right.
It's not going to just be, oh, this happened this year. And you have to work on your health, just like you do everything every day.
Yes.
And just like you do with exercise and diet and sleep and all the other health factors that we want to work on every day, you may have to make sure you're also keeping your hormones in check.
Yes. Yes. I have a client. We noticed that she had some shedding in her hair. Her skin was looking just a little kind of pale. What else? She said she was kind of tired, and then she had to start on some birth control. And once the birth control got in her body, it really made a difference. Like her hair wasn't shedding, and the spots, it started looking a lot healthier, feeling a lot healthier. She said she felt more energetic, and she was good. And she was just
Now,
missing that
how
hormone.
old was this client? Was she in the perimenopausal range?
She's in perimenopause.
Okay,
Yes, she's in
okay.
perimenopause. So she's like 40 something.
Okay,
I think she's 40
okay.
something.
Okay.
But yeah, she's peri. Yeah.
But I will also say is the estrogen also does help with hair growth. It can help with making sure. Again, you think about everything in the 20s and 30s when you had healthy hormones and they were at their most highest number and things like that. Yeah, you didn't have to worry about thinning hair or being so tired and things like that. So again, it's just replenishing the hormones that have been depleted.
Yes. The older you get, the things just start falling apart.
And so we have to get them back.
Yes, quick.
So one of the things I will also say is that I actually have an estrogen cream, vaginal cream.
Okay.
And that helps with the vaginal dryness.
Oh,
It
wow.
also helps reduce any type of yeast infections, if that's
Oh,
something.
wow. Wow.
Urinary tract infections,
Wow.
decreases, can eliminate that. And it's funny because when I went to talk to my own primary care physician after having been with the specialist, and starting the hormone therapy, maybe about 6 months in, and she said, well, it's fine. You do what you want to do. And I said, well, do you do any hormone therapy? She said, no, I just don't. That's not me personally. I don't do that. She said, but I do the estrogen vaginal cream. So it's not, it's totally localized. So the estradiol cream that I use, the estrogen vaginal cream, it is localized only to the vaginal area. Okay. So it's not systemic where it's going throughout the entire body. Okay. So if that's something that's because that is a huge sign of perimenopause and menopause is the vaginal dryness. And even in women that are senior citizens, like in their 80s plus, I know oftentimes if you have a woman in your life that's that age, they get very frequent UTIs, very frequent UTIs. And that's one thing that both of the healthcare providers say. The vaginal estrogen cream, you can use it for the rest of your life because it will decrease some of those side effects with the UTIs, the yeast infections, and some of the things that come with just being even in the very senior ages.
Oh, wow. So it helps kind of get the natural flora back.
Exactly.
Awesome.
Exactly.
Awesome. Oh, that's good. Man, that's good. So I know that helps you feel a lot better because that can be very uncomfortable.
Yes.
Very uncomfortable.
Honestly, I think that was one of my biggest side effects was the vaginal dryness. Wow. That was huge because, like I said, I didn't have the hot flashes and the night sweats.
So that was your trigger there. Ugh, man, that sucks. I think I almost probably rather have a night sweat or two than that. Oh, that hurts.
So the cream is the same twice a week. It's like just as though you was using a cream for a yeast infection, the ones that you buy over the counter, and you just insert it twice a week. And so I do it on the same evenings after my shower or whatever that I put the patch in, and that's just keeps me on a routine.
Right on. Very good. I'm glad you decided to do that for yourself. That's real good. And probably someone else probably thanks you for that too.
Yes.
So I'm
not sure if he's listening now.
So how does a person know they are a good candidate for HRT?
I really think it's a conversation that you would have with your healthcare provider. And one thing to note is that we can't ignore the symptoms that are going on. Like I had mentioned earlier, you may think it's something small, but like, oh, I'm just really tired, or oh, I get hot, and oh, this or that. And start writing all of those things down. If you notice that doesn't feel like how you normally feel, speak with your healthcare provider about that because they may say, maybe you need to do this. One thing is that a lot of the primary care physicians or a lot of the OB-GYNs, they don't know enough about this. All they just know is what they normally do, and this is the extra mile. So you really need to seek someone that is doing menopause treatment or a menopause specialist. Okay. Now, I had 2 of the docs tell me last week, you should not be paying for menopause treatment. If this is not part or regular insurance that is covered, no one should be going to the boutiques and things like that where they're paying thousands and thousands of dollars. You can, if you feel as though you're not getting the answers that you want from your actual healthcare provider, but they're boutiques. And it's just like with maybe some of the other boutique type things you go to, there is an extreme cost, but this is health maintenance. And a lot of these things should be covered with your regular insurance by working with your healthcare provider.
So some of it is just people just taking advantage of women that are going through that somewhat.
Somewhat, because you have to consider there is that population that doesn't want to talk to their doctor about it, that or their doctor doesn't even want to go into the conversation with them. Oh, you're just getting older, you'll adjust. So there is that professional that they want to seek that's going to give them that information. And it may be in a boutique setting. Maybe they're not finding the right provider that is going to give them what they necessarily need and take their hormone levels. Like my provider this year, after being 1 year with the IUD, with the estrogen patches, she did do my hormone levels. Because she did not start by taking my blood to check my hormone levels. She did 1 year later. And it does show that I'm in perimenopause.
Oh, wow. Yeah, I do.
And so she's like, we're on the right course of treatment. Everything is going to remain the same. So then when I see my primary care physician for my annual in October, then we'll see, okay, what is my cholesterol levels looking like? What are my blood sugar levels looking like? And then things like that. So it really is a team approach. And even though this person on the team may not talk to this person on the team, it's really important that you're communicating with both of the people on your team, what you're going through, so that they know, and that one is not prescribing something that is not going to be beneficial or counterintuitive to what the other is prescribing.
Okay. Ladies, as I always tell you all, and I tell a lot of my clients this, please, whenever you go to your doctor, ask for a hormone panel, because it is a complete different blood workup. And this will be able to tell if you're in peri or if you're full or even if you're post. So please go ahead and make sure you ask for that hormone panel, because it does make a difference, and it can tell everything, if whatever is low in your body. So yes, and what she just said, that's very, very good. Are there different types of, and I believe you already went over there, are there different types of HRT, and if so, how do they differ?
So again, there's the progesterone, there's the estrogen, and there's the testosterone. Now, this is one thing that, let's talk about the testosterone.
Yes.
Because I know women are like, no, testosterone is only men.
Oh,
yes,
no.
We're born with testosterone as well.
Yes.
Okay?
Yes.
And it is important. Now, here's one thing. I have not started on testosterone, but she is now, my provider, after this 1 year, has given me a prescription for testosterone. And I do plan on actually getting that filled. I have heard so many providers say taking that testosterone will help preserve that muscle mass that we need. That muscle mass is going to help us to keep our bone and everything, so that we can make sure that we're not falling. And when you fall, that there's no breaks, decreasing osteoporosis, having good muscle mass so that you're able to just move. Yes. You know, you see older people when they try to get up and they just can't get up. They pushing hard in a chair. They just can't get. That's that muscle mass. And it is so important to increase that muscle mass as you age, by having your protein, making sure you're doing weight-bearing exercises. No one's going to look like they're bodybuilding. That's correct. That's not going to happen.
Yes.
Because we do have testosterone in our body.
We do.
And the amount, now here's the thing, the FDA has not approved an amount of testosterone that is for women. So that's why it is very imperative that if your provider does prescribe that you definitely know the proper dosage. Don't quote me, but I think it is 0.05% for women. Like it's a very, very minimum amount that is needed in taking a testosterone gel. And so that is what I have been prescribed as a gel.
Okay.
And she even went over how I should be using it, and just a pea-size amount on the inner thigh. And that is it. But the thing is, insurance does not cover that gel because it has not been approved for women by the FDA. which is crazy. And I would suggest that if anybody is wanting to even think about that, that you do your research on that. And there are actual where they're lobbying now, women's groups and things like that to try to get testosterone approved by the FDA for women.
Wow. And some of us have too much testosterone. Hence the hairs on the chin.
So I will say this, a lot of the boutique hormone replacement therapy places or things like that, they provide what are called pellets.
Yes.
And some of the providers report also give prescriptions for pellets as well. However, with the pellets, I have found out that it provides too much testosterone at one time. It's not regulated. It's kind of like a multivitamin. You know how you may have a multivitamin that has all the vitamins you have in it, but it gives you a little bit of everything. Whereas if you take a calcium supplement or you take your magnesium supplement and your D and your B separately, you're getting amounts that you feel are appropriate for you and not just little traces here and there. So with the testosterone, it is really important to note that the pellets don't have a regulated dosage. It's just all one dose along with the estrogen and the progesterone. It's all like just one multivitamin almost, you could say. And with the pellets, it has been proven that you may start to get more of the hair, the facial hair, and some other hormonal changes that we as women just don't want.
Oh, wow.
That's over a long time use of pellets, though.
Oh, wow. So you're going to unbalance the unbalanced.
Exactly. So that's why it is really important to say, do I need this? Do I need that? Do I need this? Have your hormone panel done, because you may not need this. Right. I don't need progesterone right now. But it did show that I could definitely benefit from the testosterone, which also increases your sexual libido.
Okay.
Okay.
You said the testosterone increases in sexual libido. Wow. Okay. Ladies, you heard that. So you may need that. Talk to your provider. That might be something that you all really need.
Now, my provider said it takes 6 months to kick in,
Ooh.
but just to note that, that is something. Also, like I said, with the muscle mass, it also helps with the brain fog. And I think that's another one of the bigger things that brain fog is there. And I know we talked about that a couple weeks ago on your on the show here on Funky Disposition.
Yes.
I have really bad brain fog. Oh. So my two things are the brain fog, vaginal dryness. Those are really my worst symptoms.
Oh gosh, no.
And the testosterone will help with that brain fog.
Oh, that's good.
And decrease the metabolic rate that we talked about earlier.
Yes, that is good. Yeah, you can't have a brain fog forgetting that you got vaginal dryness. So yeah, you got a whole messed up.
Now what was I thinking I was supposed to take this for? This is toothpaste. No, it's not.
No, it's not. So what's the difference between bioidentical and traditional HRT?
So with the bioidentical, that really is where they're trying to make sure that it's not more the synthetic. There are different ways that you can get the hormones. I just choose to have mine through prescriptions, but you can have those bioidentical by having oral hormones. Okay. There are oral hormones that can be taken, and then things that are not necessarily traditional Western. But again, that's something that you really will want to talk to your healthcare provider about.
Okay. So, what are the risks and side effects associated with HRT? I
think the biggest risk, and that's the one that it was from the study back in. And it was from 2002. It was the Women's Health Initiative study. And that was where mostly the women in this study were 52 to 79 years of age. And what they found is that the women seemed to have increased risk of breast cancer. And that was when everything was like, don't use hormone replacement therapy. Hormone replacement therapy is bad. But there were also factors that they didn't take into consideration. And they didn't do a combination of the progesterone, the estrogen, and looking at those. So I think that's where the myth still lies, is that hormone replacement therapy causes breast cancer.
Mm-hmm. Yeah.
I would say that the benefits outweigh the risks, but it's also your current healthcare status. If you are not necessarily a healthy individual, or have had a previous cancer diagnosis, or there may be cancer in the family, that's something you really would have to talk with your healthcare provider about, to find out, are you personally a good candidate for that? Because there were things that I had to do before I could even, like I said, I had to get an IUD placed before I could start the estrogen patches, because otherwise I could have been at increased risk for uterine cancer, endometrial cancer, because of the overgrowth of the lining. So there are other things that have to be done in order to make sure you don't put yourself at risk for other things.
Okay. Yeah, because I did read that about the endometrial cancer that the estrogen can cause, and it was saying that it was just basically women that had their uterus still. So as you were saying, if the uterine lining has an overgrowth, then yes. Something else I researched was vaginal bleeding or bloating, breast tenderness, mood changes, nausea, and risk of blood clot, stroke, and those in this saying, like, in individual factors, those can be different side effects or
they can
risks.
Definitely. But again, that also goes to your lifestyle and your diet. You all right?
Girls, it's a gnat. That's a gnat over here. I've been watching it the whole time.
Exactly. So, but again, lifestyle, diet, exercise, none of this is, I will say, none of this can be effective without a proper diet and proper exercise.
Yes.
That contributes to everything in life, in my opinion, just professionally as well as personally. Okay. So you just want to make sure, because there are women that'll be a certain BMI that the physician will say, no, we're not going to do this. Or they may have a certain family history or personal medical, history that they're not going to be the candidate for that. So I wouldn't suggest anyone just go out and tell the doctor, I want this. This is a conversation that they have to have, because it can cause exactly the blood clots and things like that. Me personally, I don't concern myself with those. Okay. I like to say that I am a healthier individual. I do see my physician on a regular basis, not just my primary care physician, but also my OB-GYN. Mm-hmm. And I decided to go to the specialist because when I asked my gynecologist, not this year, but last year, I said, I really got to figure something out. I think I'm having this and this and this. And I said, and then this 10 pounds, it just came out of nowhere. I've been doing the same thing. And she said, well, it's just a part of aging, and a little bit, maybe you can take Ozempic or something.
Wow.
And I was like, well, wait a minute. Like, that wasn't the answer I was looking for,
Oh, wow.
Ozempic was not the answer to help with some of the other things. So get a second opinion. You don't have to take your provider's answer as the end all be all answer. Mm-hmm. If you're looking for more of a holistic approach, find someone that's holistic.
Yes.
If you want someone that practices differently than what you've traditionally done, then do that. But it also is a matter of taking your own health care into your own hands and doing your own research. Yes. And Trina, you have done really good in making sure that, with this platform, that it's not just about hey, something to talk about, that you've done your research and know that these are things that women are dealing with. And, we're just not saying anything. And I think it's been over the last 4 or 5 years, maybe 10, is that the whole conversation with menopause has come into play because, it used to have to be quiet. Hush, hush, nobody talked
Yes,
about.
yes,
But there are a lot of advocates. There are a lot of celebrities that are saying we're just not going to stop with this. And so now menopause is part of legislation. And it's being talked about. It's not quiet because we don't have to be quiet about this.
yes, yes.
Women are not, you're 65 and that doesn't mean anything. You're a healthy, sexual, active woman and you want to continue that way.
Yeah.
And so you don't have to stop just because you turn 65. You don't have to stop just because you hit menopause at 52.
Correct.
Or, that doesn't, it's not a death sentence.
Right.
And women want to still feel healthy and sexy and attractive.
Yes, yes, yes.
And with no filter.
Yes, yes, very good. So, how long can someone safely be on HRT?
So again, I think it needs to be evaluated annually.
Mm-hmm.
I think for me, we had my hormone panel done after year 1. And then she'll do it again after 5 years.
Okay.
After the time when it'll be time for the IUD, just to evaluate, should my IUD be removed at this point?
Okay.
That'll also help determine if I am menopausal by that point. Because like I said, I am 48. So in those 5 years, maybe I will have then gone into menopause. I won't need the IUD. Then we'll have to reevaluate what's next.
Oh, wow.
So
Okay.
I really think it's a matter of determining with your provider annually if something changes, and then, in increments 3, 5, 7, and so forth years.
So just individual person, what their body is doing at that point in time.
Exactly. Because what's happening to a person in their mid 40s could be totally different and will be totally different than someone in their mid 60s who is actually postmenopausal at that point.
Okay. How soon after starting HRT can someone expect to see and feel changes?
For me, it was 6 weeks.
Oh, wow. Okay.
6 weeks. So it's not immediate.
Okay. Yeah, because it got to take time to get in your
me,
body. So yeah.
Exactly. My provider told me this is not a sprint. It's a steady race.
Kind of like menopause. It's a steady race. It's a steady race. Oh my gosh.
It's a steady race.
You find out new things each day. Something different happens each day, y'all. It could be anywhere from hearing. I had a friend tell me that her hearing had reduced, and then it just came back. And when it came back, it was like surround sound. So hearing can be affected also in menopause. So
well, here's something funny. Is one of your guests a week or so ago? I don't know. I don't even remember what show it was. They were saying the dry skin.
yes.
And I have this dry patch that I was starting to say, well, I asked to get a referral to a dermatologist because I didn't know if it was something that needs to be looked at, like a cancerous mole or, like a skin cancer for me. But it's just a little dry patch. And it's like, oh, yeah, that probably is related to that.
Yeah, because you can get eczema and you can get acne.
But it was one of those things I just didn't think about.
Right. No one thinks about it. I had a client, she kept getting a spot like right on the back of her neck, and we thought it was from a product, but it actually was from menopause. And it took us a little bit to figure that out that, oh, it's menopause.
But again, those are one of those symptoms that you think is nothing, or you're just thinking it's eczema or something like that. You really just have to start writing these things down.
Yes.
It really didn't pop into my head until I heard the guest say the dry skin. I'm like, that is so true. I had this dry patch and it is just in one spot.
Yes.
And it bothers me every now and then. And I was starting to get concerned because it's right on the upper part of my breast. I'm like, oh my gosh, like what is going on?
Yes.
both my primary care physician and my OB-GYN specialist, like there's nothing there, but they said still just go to the dermatologist just to make sure,
Mm-hmm.
But again, that's probably due to being perimenopausal.
Yes, it is, because there's different spots on your body that could be one spot, as you're saying, that'll itch, and then it'll go away, and then it'll come back. There's a young lady that we was talking the other day, and we was talking about itching in the middle of our back. Don't know what that's about, but it just itch, and then it'll just go away.
And then it goes away.
It's just the oddest thing. Why we have to have this itchy thing? I don't understand. But I guess I do, because again, our hormones are unbalanced, which makes us, causes all that to happen.
But
so
think
we get
about
dry and
when-
itchy, and all the moisture start coming out our body and all that. So
yes, that's what I was gonna say. Think about how when you're 20s and 30s, how supple your skin is,
Yes.
and moisture, and then
Yes.
older, and then you know how it's like you see older women and their hands are just so dry. and
Yes.
it's the hormones that just deplenish. They're going and they're going and they're going. And when you're born as a female, you're born with all those hormones at one time, and we lose them.
Yes. So that sucks. That sucks. Y'all just get you some Vaseline and some all kind of stuff and just grease yourself up, child, because you're gonna need it. Some coconut oil, some everything, and get your hormone levels checked so you can make sure to try to get your moisture back into your body.
Yeah.
So
I would agree.
can HRT be used alongside natural remedies or lifestyle changes?
Absolutely.
Okay.
Absolutely. 100% lifestyle change, as well as natural remedies, because I'm not a huge person to take, prescription medication.
Mm-hmm.
So even though these are prescription, I'm not taking anything oral.
Right.
It's a patch and it's a cream. And then when I get the testosterone, it's a gel. One thing I will say, and this was funny, I just being in the profession that I'm in, I just hear women saying, one woman was saying she was nervous to start with testosterone because her provider had told her to put it on the inside of her arm. And she said she picks up her grandkids and she didn't want transference to her grandchildren from skin to skin contact. So she had to take and talk to her healthcare provider and said, that's not where I can put it. So they say, oh, okay, well, you need to put it on the inner thigh or somewhere that you're not going to have a skin to skin contact with someone that would transfer that. So those are things that you have to think about, though.
Oh, wow. Yeah, never thought about that it could transfer to somebody else, and then poor baby having all kind of hormones, and they got enough stuff going on, so we don't need to add no more energy to them children.
Right. Exactly.
Wow.
So those are just things that you have to think about and really make sure that you have a healthcare professional that kind of just knows your lifestyle as well. If you're someone that's taking care of your grandkids daily, or if you're a healthcare provider that takes care and lifts patients and things like that, you have to be aware of yourself and what you're doing in order to make sure that your provider knows what you're doing. And one thing, when you make that initial visit with a menopause specialist, I've heard this from at least 3 providers. That first initial meeting is really a consult. Clothes on, we're not doing any type of screening or anything like that. They want to know what is going on with you. That is what it should be all about, almost like an interview. They're interviewing you and you are interviewing them. It is a longer conversation, so it shouldn't be like the 10-minute visit that you may have, or the 15-minute annual visit. This is a 30-minute visit, fully dressed, one-on-one conversation with the provider to say, this is what is going on with me and how can you help me and what should we do?
Okay. Well, that's pretty good there.
It's a consult.
It is a consult. It should be a consult.
Exactly.
It should be a consult. a quick menopause story right now. So
Okay.
I am very tired. And because I am tired, and because if you're stressed or tired or had a lot going on, with you being on a person being on full menopause, which I am, you would feel like things are crawling on you and it's not. And that's just because your body is tired. And with menopause, these things tend to trigger other things. So if you're tired, it may trigger that you feel like things crawling on you. Or if you're tired, it may trigger itching. If you're tired, it may trigger something going on with your hearing.
Yeah.
Any of that. So all these different things that can trigger all the other reactions of menopausal moods. It is a true thing. So right now, this is what I'm feeling. So y'all keep seeing me doing this is because keep feeling like something is crawling on me and it's not. It's
Well, you was
actually
swatting
not.
at me.
Now, a while ago, it really was a gnat in here. So I really was swatting it because it kept coming over here and messing with me and stuff. So, but I'm just giving y'all some real live things right now. This is something that is really live and happening to me right now, and it's really irritating. Myself, I am not on any type of hormone replacement therapy. I did try the estradiol, and I'm not good with pills, so I just stopped taking it. But what I do take is the DHEA because my body really does get real tired, and I can tell I don't take it like I'm supposed to, like the doctor told me to take it. I will admit that, but I do take it at least twice a week because my body will get tired. It'll just all of a sudden just feel run down. And I know if I didn't take my DHEA, then that's what happens. So make sure you pay attention to your body. Your body really is telling you what's going on and everything. So
It does.
really, really pay attention to that. Also, on that question, about the natural remedies. I looked up that diets like phytoestrogen diet, like flax seeds, legumes, foods rich in calcium and vitamin D, exercise, again, managing stress, sleep,
Yeah.
herbal extracts, and minerals. Those are the things, natural remedies and lifestyle changes that you can do alongside with HRT. So,
But again, it's all holistic approach to your whole
yes,
life.
yes, yes,
And it may
yes.
seem like, I know one thing with vitamins and any type of, things like that,
Mm-hmm.
definitely it's going to be costly. It
Yes,
really is. But
yes,
the one thing, and your brother is real good about this. He was like, well, it's not as costly as a medical bill. So
yes.
it is
Mhm.
important that you say like, oh man, I'm dropping $60 on a vitamin. Well, when you have your annual visit and you have your blood work done, the question is, how do I know these vitamins are working? Well, you
Mhm.
don't know until you get those blood work done. So
Yeah,
you know it's working if you don't have any issues going on. And
correct.
your blood work comes back, hey, my cholesterol is pretty good. Maybe it's because of the flaxseed. And
Yes,
hey, my cholesterol is lower, and maybe it's because of the fiber that I've been taking. So
yes.
it's a whole host of things.
Okay. So, y'all see, make sure that you just need to be taking care of your body anyway. I
Hmm.
understand that it may be a costly thing, but you are important to you. You are very special, and you should want to take care of yourself, and you should want to make sure that everything is lined up like it's supposed to be. I mean, it's only one you, and you want to keep that one you together as much as you can.
Agree.
Yes. So, what do you say to women who are afraid to try HRT because of past medical scares?
I think that's one thing that we, um, as a culture, as a people, as African American women and men,
Mhm.
we have to get past not being able to talk about past medical history within the family,
Mhm. Mhm.
um, about not having conversations about what's going on with you. I know we're talking about hormones and menopause, but mental health therapy and think we as a people have to not be afraid to go to the doctor.
Yes.
and realize that we have to take care of ourselves. We have to take care of our families. And it is so important to have a relationship annually with your healthcare provider, because all of that comes from the stigma and past traditions and people saying, "Oh, I don't go to the doctor because the doctor's going to give me this and this and this and this." And you may need to.
Mm.
My grandmother on my father's side, she hadn't been to the doctor, not one doctor, since she had her last child. And so that child was in her 40s. Her husband of 50 plus years passed away, and immediately her body failed and she never recovered. Wasn't sick at all. Was not sick, but she did not see any type of physician, gynecologist, or anything. She said, "No, I'm not going to do any of that." And her body, her husband died, and her whole system just went away. She had to have a hysterectomy. Just everything was going on, and she didn't even know her system totally failed. She never recovered.
Oh, wow.
So, because of the stigma of going to see a doctor.
Yes. And I know a lot of older women, older men also, they do not go to the doctor because of that, or they just, I don't want to know what's going on with me. I'm scared
Exactly.
because they're scared to know what's going on, or scared to know, oh, I need to take some kind of treatment or whatever. And they do need to get out of that because it could be something that could save you.
But find someone that looks like you.
Yes.
If you have an issue with going to the doctor, be vigilant in finding a healthcare provider that looks like you.
Yeah.
I will say that I only have female providers for everything, all the way down to my dentist.
Oh, wow.
That's just me personally. I personally feel as though, having a female provider, they know exactly. They're women, so they know exactly. They may not be having all the same symptoms or things like that, but just like I said with my primary care physician, she regularly uses a vaginal cream, just because I even asked her, "Well, do you do this?" And then don't be afraid to ask your healthcare provider for them personally.
Yes.
Would they do it?
Yes.
Because I think that's a question that if they want to prescribe this or that or the other, say, "Well, would you take it? If you had the same thing going on as me, would you take it?" And if they say no, then ask that question, "Well, why not?"
That's, because that could make you or break you. So yeah.
Exactly.
Yeah,
Exactly.
that's very good advice. Thank you on that. Is there a difference on how HRT is approached for early menopause versus natural menopause?
I don't necessarily have an answer for that, because I think it's symptoms. I think that, like we said before, not everyone experiences the same symptoms.
Correct.
So, menopause, the true definition of menopause is 1 full year past the menstrual cycle, or for those who may have already had a hysterectomy.
Right.
So we have to say there's no right age for what your course of treatment is going to be. What they do recommend is that 10 years prior, or at least beginning at 60, you start some type of 10 years prior to menopause. It is recommended to start some type of hormone replacement therapy 10 years prior, or beginning at 60 if nothing has been done before that. But that doesn't mean if you're 62, you still can't try hormone replacement therapy. You just need to talk to your provider about what it is that they would suggest.
So you said 10 years before they're 60?
No, 10 years prior to, so if perimenopause, I have a diagram here. So menopause is usually 51, 52.
Right.
There's the late perimenopause, which is defined as going 2 or more months between periods. This phase typically lasts for 1 to 3 years. There's early perimenopause with a cycle length varying of 7 or more days. Additional symptoms start to begin, and the length of time in this phase can range anywhere from 10 years on. So that's why I'm saying if you have that age 51, they're suggesting 10 years prior
Oh, wow.
51 or 52 being menopause, 10 years prior, you can start hormone replacement therapy.
Oh, wow. Okay. Oh, wow. Okay.
Because there are some women that start in perimenopause around 35, 37,
It
and
is. It
and
is.
you just don't know.
It is. It is. Which I don't know why they starting so early. I don't know. I don't know if it's just the way the world is now, things they're eating, just the way the body is made up, whatever it is putting women earlier into perimenopause.
Just
And
like but girls too are starting their menstrual cycles a lot younger, so that
yes,
could lead into.
yes,
I mean, you have to think about it. If you're starting your menstrual cycle a lot younger, you may be hitting perimenopause a lot younger.
this
So
is true.
it's all a process of the aging process.
Mm. Yeah, this is true. Wow. Is there a difference? Oh, wait a minute. Are there any alternatives? And I know you went over this again, but we're going to go over it
Mm-hmm.
again. Are there
Yeah,
any alternatives for people who can't or don't want to use HRT?
there are.
Okay.
Because again, not everyone's going to want to do this. I don't
Correct.
suggest that everybody do this. Everybody has to do what's comfortable for them.
Correct.
So there are alternatives. There are vitamins,
Mm-hmm.
but like Trina said, she's not real good about taking pills.
Mm-mm.
But there are foods.
Mm-hmm.
There are foods that you would need to do your research that help with hot flashes. Protein will help with your muscle mass, things that reduce your cardiovascular risk, foods that reduce your cardiovascular risk. So, yes, there are, supplements, vitamin supplements, and things like that that can be taken. Now, I do take vitamins. Don't get me wrong. I don't just use the hormone replacement therapy as my end all be all. I make sure I take vitamins to balance everything out.
Right. I know also people can do acupuncture. They can do vaginal lubricants and moisturizer, cooling techniques, stress
Yoga.
management, yoga. Yes.
That is one. That is
Avoiding
one.
triggers, healthy diet, regular exercise, prescription meds, and other therapies. So yes, those. What else have you tried before you went into HRT that you thought that, oh, okay, if I can try this might help along?
So I was thinking, I didn't try anything. It was one of those things where I didn't really know I was perimenopausal until you start thinking about things. And I was saying, oh, I was doing Wordle every day, making sure I kept my brain going and, and decreasing brain fog and things like that. But I always make sure that, checking on teas and reading what certain teas do. I'm a big tea drinker, so there are certain teas that have effects that help. But as far as me doing anything, I didn't realize I was perimenopausal because I was not having the hot flashes. There's that fly again.
It is.
I wasn't having the hot flashes and the night sweats, which were the only things we think are happening with perimenopause or menopause. But I just didn't realize that some of the other things were perimenopausal, so I really wasn't doing anything.
Okay.
I mean, you know what I'm saying? Like,
Yes.
I didn't know why I had vaginal dryness. I just like, oh gosh, what is going on? Or I
Right.
didn't know that, why I wasn't remembering things. I
Right.
just didn't know. I thought it was a lack of sleep.
Right. Yeah, because we thought you was tired.
Yeah,
Yeah, we
I still
thought you.
am.
Oh no, get some rest, girl.
I know.
Please get some rest.
Right.
What advice would you give someone considering HRT for the first time?
Research. Do your research first. Read about it. Read even if you go see someone and they prescribe, this is the thing we're going to do. Like I said, I haven't filled my prescription yet for my testosterone because I'm trying to do my research on this end. Just because they gave it to me doesn't mean I need to take it. And that's one thing that we have to remember. Just because it's prescribed to you, if it's not life-saving, doesn't mean that you have to take it.
Yeah.
And so I hadn't filled my prescription yet because I wanted to continue to make sure that I did my research on how all of these are going to balance things out.
Oh, wow.
So that's the biggest advice. Do your research and find a healthcare provider that you trust.
Okay.
Because if you don't feel comfortable with your healthcare provider, and that's the thing, you have to feel comfortable. If you do not feel comfortable, now that doesn't mean feeling comfortable, they're going to give you the answer that you want every time. So just because you get a no on this, like, well, I'm going to find another doctor and I'm going to find and keep going to a different doctor. There may be a reason why, you know.
Right.
They're not going to always give you the answer that you want.
Right.
But you have to do your research with the answer that you have been given, or make sure that you're definitely comfortable with the healthcare provider or the healthcare team that you have. And all of them work differently because they have specialties. And the other thing that I would say is find a menopause specialist. That is the biggest thing. A lot of providers are accredited with the National Menopause Society. That is actually a website that you can go and see if your provider is certified with them.
Really?
So you can actually go to the website and I can send it to you, Trina, so you can put it on there. But you can go in there and see if your provider is certified with them.
Wow. That's
or find
cool.
a provider in your area that's certified in menopause therapy.
Oh, wow. Yeah, that's some good information right there. That's something that probably a lot of ladies didn't know. So now y'all know. Is there anything else you'd like to add on to this? We covered a lot of stuff, but hey, if there's anything else that you'd like to add, feel free.
I just say know what's going on with your body. And even if you don't, your partner may say, hey, you know, this may be different, or you seem a little bit different here today, or this may be a little bit different. Make a note of that.
Yes.
Especially if they're telling you that on a regular basis. So say, maybe I am. And be honest with yourself and have these discussions with other women. We don't have to be quiet about it. My friends and I talk about it.
Yes.
You know, it's so many different memes and Instagram reels now with, you know, and I know you and I share them and send them to each other about, you know, my favorite one is, I think this woman was going on an escalator, but she was going the wrong way on the escalator. It says, oh, when you're trying to deal with the weight, the sleep, and everything else of perimenopause, it just keeps pulling you back. You keep falling backwards down the escalator. So I think it's a matter of having a village of friends as well.
Yes.
Be it your hair professional.
Yes.
Because I do speak with mine about the things going on too.
Very good. Very good.
You know, your sister-in-law,
Yes.
your sister, your aunt, your mother,
Yes.
Your daughters.
Yes.
You know, because they're going through hormonal changes too. So
Correct.
just building a village of support and not being afraid to talk about it. Find somebody to talk about it.
Yes, because there is a lot of ladies that are afraid to talk about it. They think I don't want people to know what I'm going through, or I don't want to put this out there because I'm ashamed, or because they're going to be looking at me like, oh my God, you're going through that. So, and they need to know that your story is going to help someone, because as far as I know, I've been getting a lot of people telling me that since I've been doing this has been helping people, because they've been getting educated on some things they didn't think about, or something they didn't know, or whatnot. And this has been helping, and I'm glad this is able to help them. And the people need to know, tell your story. It's okay to tell your story. It's okay to contact me to tell your story, and we'll put you on here, and we'll let them know, because the more you know, hey, it's that education is key. Education really is key, and it can keep you from harming yourself, or it can keep you from thinking that something is wrong with you when it's just an unbalance of your hormones. So that really helps when we can all just bounce things off of each other. Go listen to a podcast, talk to your peers that is going through the same thing and that is on HRT, or they're trying this medicine, or they're trying holistic ways to get themselves back in balance. Talk to these people because it can really help, and it might not work for you or it might work for you. So
Yeah.
you just have to try it.
That's what I say.
Yes, yes. Well, Inyota, I want to thank you so much for your time. Your time is precious, and I appreciate it. And I'm pretty sure everyone appreciate that you are sharing what you needed to share with us, because it helped a lot. And it can help some woman out there that been struggling about HRT, and now they can see that how much it could help them and the benefits it can help, and it may not cause any risk to them as they think. It may or it may not. It just depends on the person. But with you just sharing your story, that helped a lot. So we so appreciate you, and we just love you to death.
I love you.
Well, love you to life. So you all, on our next issue, July the 13th, we will have 3 men here giving their experience about menopause and how they watched somebody go through it and how they dealt with it and whatnot. And oh my gosh, y'all, it's going to be something. So we will have Alvin, we will have Reggie, we will have PJ, and they will be giving their experience about menopause from men point of view. So y'all stay tuned, July the 13th. Also subscribe and like on all the platforms that I'm on. And we just love you out there. Again, consult your physician. We are not physicians. We are just here to give our experience to try to help you all. So we want to just thank you all for tuning in, and be easy.
You tune it in to Funky Disposition, where menopause meets the mood swings. Real talk and good vibes. Hold hot flashes, cold cruise.